In today's video, we're going to go over how to obtain a bladder pressure for a patient with suspected abdominal compartment syndrome.
Let's start by going over the supplies we need to have ready at the bedside. First things first. Your patient will need an indwelling Foley catheter. For the Phillips monitor, make sure you have an extra pressure cable available to connect to the transducer tubing. From the clean supply room, grab the following: 1 package of transducer tubing, with or without the vamp, a bag of normal saline fluids, a 30 to 60 milliliter syringe, an alcohol prep pad, and last but not least a set of clamps, the blue ones preferably, as they are not as likely to damage your catheter tubing.
Now let's get our monitor ready. Grab your pressure cable and hook it into any available port on your monitor. Next, activate the waveform. You can use either a CVP, UAP, or UVP waveform to get a bladder pressure reading. After you selected and activated the appropriate waveform, you can adjust the scale as needed.
Now that our monitor is set up, let's prime our transducer tubing with some saline. Once our tubing is primed, we can go ahead and hook that up to the specimen collection port of the catheter. Use an alcohol prep pad, cleanse the port, and allow time to dry before connecting the tubing. After connecting the transducer tubing, you may connect the pressure cable for the monitor.
It's time to zero our monitor, but since this is a bladder pressure, we need to put the transducer in the correct position. To correctly zero, we need to place the transducer at the level of the iliac crest at the mid-axillary line. For reference, this is located approximately around the top of the patient's hip bone. Once placed correctly, you're good to go. You may adjust the scale of the waveform as appropriate.
Next, you're going to prime your syringe with 30 milliliters of normal saline. An easy trick is to attach your empty syringe to the most distal port available on your transducer tubing. Turn the stopcock off to the patient, and then use the pigtail while pulling back on the syringe plunger. Stop when you get to 30 milliliters and get rid of any air before proceeding. A few things to consider. The patient should be laying as flat as possible, and ideally paralyzed if there is a serious concern for abdominal compartment syndrome.
Finally, it's time to get our bladder pressure reading. Use your clamps to clamp the catheter tubing distal to the specimen port. Remember that if you are using the metal clamps, you may want to protect your catheter tubing with some gauze or tape. Turn the stopcock off to your pressure bag. Then instill the 30 milliliters of saline into the patient's bladder. Turn the stopcock off to the syringe, and leave the catheter tubing clamped while you obtain your reading. For an accurate reading, wait about 5 seconds and always measure at the end of expiration. Don't forget to unclamp the catheter.
This video was brought to you by CNE Productions. Remember to check our resources folder on SharePoint and other videos for all things medicine ICU. Thanks for watching.